We'd like to talk to you about basic injuries, and one of the injuries we're really concerned about is an ankle injury. Ankle injuries are pretty common, can happen anytime you step wrong, step off the curb, step out of the shower, running, physically active. So what we'd like to discuss is some basic procedures, injury recognition, some advanced support for injuries, and then treatment, and then taping procedures. First of all, always remember that rbjc.com is available for all types of information on situations just like this. But let's discuss this. Whenever you hurt your ankle, a couple of things to remember. Pain can dictate what you're going to do. If you've had an ankle injury before, then you've had some previous experience, so you can kind of gauge, kind of measure what your injury, perhaps how intense it can be, how difficult it can be to manage. But if you never hurt your ankle before, let pain kind of be your guide. If you have crutches, it's always good to get on crutches, kind of keep, be non-weight bearing at all times. But use ice. Use ice for the first 24 to 48 hours. Some people say use heat. We don't. We prefer that you use ice because ice can help control swelling. Keep your foot elevated. Think about using elastic wraps for some pressure. They come in different sizes and they're pretty easy to apply. If you decide to come see our physicians because you feel that there's something that you need to follow up on, several things can be done. Obviously, x-rays, the physical examination. Depending on what the doctor decides, they can put you in various support devices such as boots. These are walking boots. They do help stabilize and mobilize the joint. They do come in different sizes. As you advance to that, from that, you can use different ankle braces, such as an air cast. Some of you may recognize what this is. Simply put the foot in there at 90 degrees. You close the Velcro procedures and you can use it as you move through the day. If you're very physically active, you can also use a lace-up ankle brace, commercially available. They do provide support for you. Remember, as you progress through your ankle rehab, a couple of things to look for: the discoloration, controlling of swelling and pain, and always use the devices the way they were intended to use. Now, what we like to discuss is some taping methods if you're ever inclined to tape your own ankle. What we'd like to discuss is your post-injury, you're feeling a lot better, you want to return to being physically active. So one of the things you can do outside of wearing your basic commercial ankle supports is you can tape your own ankle. It is a little difficult. With a little bit of practice, it becomes fairly easy. Some products that you can purchase. This is called underwrap. It's simply a foam underlay that you put underneath. It acts as a barrier between the tape and the skin. It helps prevent blisters. This is called athletic tape. It does come in different colors, but this is the basic size. It's 1.5 inches. And all you do is you're going to simply apply it, and as you apply it, you tear it. Now, that looks pretty easy. Unless you practice a lot, it's a good idea to keep some scissors close by as you do your tape job. Now remember, as you tape yourself, remember that this is a cloth back product. It is adhesive on one side. It doesn't stretch very well, but it's made for support. So when you put it on, one of the keys to remember is that it doesn't give a whole lot in terms of tension. It is made for support. So always check yourself after you've done it. Stand on it, walk around, see how it feels. If it feels a little too tight, you can walk around in it. It should loosen just a little bit, but not much. If it doesn't, and you got it on too tight, take it off and try it again. Our basic tape procedure is very simple, and if you'll watch the following graphics, we'll show you how to do it. First of all, the tape job itself is pretty simple, as you'll see in our following demonstration. Remember to keep the ankle at 90 degrees. You want to apply your underwrap from the base of the toes up to the base of the calf, or vice versa, whichever is easiest for you. And you don't need a whole lot. A thin layer is always good. You want to take a couple of pieces of tape and apply them at the top for anchors, and at the base of the toes for an anchor down there also. You want to apply 2 or 3 strips called stirrup strips for support. You also want to include a figure 8, which you start at the inside, you come back around the ankle, over the top, underneath, close it off. Another strip for comfort, and then you just kind of close it up. Remember that you don't want to use one continuous piece of tape as you wrap yourself up the ankle because it'll be too tight. You always want to check for spaces between the tape. Make sure there are no spaces, as that can cause some blisters. And then just kind of practice, kind of get good at it. You'd be surprised how well you can do. Remember, athletic tape, commercially available at most sporting goods stores, and the tape under wrap, which will help provide the barrier between the tape and the skin. All right, hey, remain physically active. Have a great day.